So good afternoon, everyone. Good afternoon, Dr. Rahul, and good afternoon to all the attendees. So, doctors, we are here to take our second webinar with Dr. Rahul. So we have started a series of our webinar. This is the second episode of the series. So in this, we are going to discuss, Dr. Rahul is going to discuss a case study on healing beyond autoimmunity, in which there will be a remarkable recovery in a 16-year-old girl that is diagnosed with UCTD. So we will see how Dr. Rahul will tell us through a case. So we will see a case also. Although Dr. Rahul doesn't need any introduction, but for some doctors or some attendees who are new to the session, let me give a quick introduction of Dr. Rahul. So Dr. Rahul Jadhav is a leading classical homeopath practicing at Satara, Karad and Pune since more than a decade. He is very well known among budding homeopaths for their inspiring and interactive lectures. Many young homeopaths describe him as their motivation to practice a classical homeopathy. He has been frequently invited for conducting homeopathic seminars on various forums. Also, previous seminars that received encouraging responses are at Amravati, Belgaum, Dapoli, Satara, Chiplun, Latur, and Pune. So it was a quick introduction of Dr. Rahul. So now we will be moving without any delay toward the session. So before that, to our attendees, I would like to tell you that here you can see there is a Q&A session given. So anyone of have any doubt. In the previous session, it was a doubt to all the attendees that where should they ask the questions. So everyone who want to ask any of the question to Dr. Rahul regarding the session, they can just put their question in the Q&A session, and after the session has been finished, Dr. Rahul will answer them. So now, Dr. Rahul, it's over to you. You can start the session.
Welcome everyone. Those who know already that we are conducting this consistent classical case study session. If I'm not wrong, more than 50. Yes, you are hearing right. More than 50 cases has been already well documented, shared with you. And I'm very happy that so many of you are learning, growing. I'm getting messages that in your actually practice, you apply these things and you get benefited. So first of all, let me make it very clear that I am also a student, a very ardent and sincere student of homeopathy. Every day I also learn from every case, and the entire motto of preparing all this case, is that with sharing, everybody should grow. So I'll directly go to my presentation now. So I think you can see very clearly my screen now. So today we are unlocking a complex chronic case through classical homeopathic case taking procedure. Now everybody has gone through the case. This is a case of undifferentiated connective tissue disorder. Now, what is this undifferentiated connective tissue disorder? Actually, I'll open the PDF now, where we have the better understanding of this. I think everybody has gone through this PDF. So here, actually, we have written everything about the case. This is a summary of almost 1 hour, more than 1 hour of case taking. Okay. So now, how this case came to me. So basically, there is one senior doctor who has sent me another autoimmune case 2 years ago. It was a case of rheumatoid arthritis. Now it had been to many rheumatologists, no relief. Then case came to me. Then we have analyzed the case. First few months there was no response. Then we tried again, put more information from literature, and then it clicked, and it has fantastically recovered. Now this doctor was very, very well understood that homeopathy can act best in this kind of autoimmune cases. That's why this other case was sent to me. So this is a case of a 16-year-old girl whose life turned upside down over the last 1 year due to strange progressive autoimmune disease called undifferentiated connective disorder. Now, what is this undifferentiated connective tissue disorder? So basically, whenever there is some autoimmune disease, they try to differentiate. There is a vast range of autoimmune diseases. If I start to talk about this autoimmune section, everyone who is attending this session must be very aware that there is n number of autoimmune diseases nowadays around us, right? From simplest, what we call, not simple, but what we are hearing frequently, rheumatoid arthritis, to psoriasis, to this connective tissue disorders, to even our day-to-day thyroid, hypothyroid and all, Hashimoto's thyroiditis, then SLE. There is huge range of disease, and simply because the body is unable to understand what is the body's own and what is coming from outside. So there is some mechanism that is getting failure. We'll not go into the detail because we are already running out of time. We'll focus on this case and remedy specifically, but still homeopathy has fantastic scope. And this is tested time and again that homeopathy has a better hand because modern medicine strongly lacking here. So here you can imagine a girl who had just passed his 10th exam, and slowly his all pain, he has been so much crippled with the pains that she's just unable to move. Okay, so in spite of under the care of best physicians and rheumatologists, her complaint not only increased, persisted, but steadily increased. Her condition getting worse, accelerating pain, weakness, and loss of day-to-day function. Now this is very important. She was not able to get up from the bed. She was not able to go to the stair. Forget about going colleges, sports, and all. So you can imagine at the peak of her youth, she has been lying in the bed due to this kind of pains. Now they have classified this disease as an undifferentiated connective tissue disorder. So now this girl came to went to the family physician first. Family physician has given some painkiller, fever medicine, no relief. Then they have gone to the MD physician, one of the city's best, eminent. I'll show you the reports also, his prescription also, MD physician. Now when the case went to there, she has been into the bad pains, into the fever, and into many other complaints. Fever was resolved by the family doctor's medicine, but so there was recently there was a kind of illnesses which is called as post-febrile arthralgia. After fever, the pain used to persist, like after dengue, after chikungunya, the pain used to persist like days, months. So they thought it is something sort of things. Okay, यानी बुखार के बाद जैसे पेन्स, बॉडी पेन कई महीनों तक होता रहता है चिकनगुनिया, डेंगू में, लेकिन in spite of giving that medicine also it continued. So they do ANA test, that is anti-nuclear antibody, which is a gold standard for diagnosing this kind of autoimmune reaction, and this came to be positive. Not only ANA but ESR found to be raised. So combining all these things, they have labeled it as a case of rheumatologist, rheumatic section, and from MD medicine, case went to the rheumatologist. Now I will quickly show you. Okay, so you can see it is clearly written by physician that there is a muscle pain, and they put for diagnosis they put some negative history, like no history of this kind of joint pain. There's muscular pain, though no history, no family strain, etc. Okay, then we have this ESR. Can you see this 65? Which is very, no, this is a CPK, sorry, this is the creatine phosphokinase. This is another marker. This is from the rheumatologist. So you can see undifferentiated connective disorder, ANA 3+ chromosome, right? Then they have given this HCQ, dulaxane, 𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸 also, I think you can see 65 ESR. So it is written here, ESR is as high as 65. It should be there in the other reports also. Yeah, you can see here, right? This is a 65, just 16-year-old girl. I will end this report section here. Okay, now coming to the PPT. Okay, so that's why the point has came to the UCTD. So they are not able to pinpoint the kind of autoimmune disease, pinpoint the connective tissue disorder. It is a in between. So there is ANA count, which is very high, ESR, CRP only, mild, and poor response to HCQ and duloxetine, which is an anti-inflammatory kind of drug. So I'll not open case record here because it will consume more time. We'll directly go to the analysis. So initial clinical picture was very clear. Okay, here, so a patient with ANA positivity, high CPK, high ESR, diffuse body pain, inability to walk indicates progression of connective tissue disorder, which is undifferentiated, towards inflammatory muscle disease. So from this connective tissue, it was going to the inflammatory muscle disease. So it is a kind of evolving. Okay, then so what is the prognosis in such case? Now this is crucial. Why case came to homeopathy? Why homeopathic intervention is very important in this case, and why we should be very alert in choosing the remedy, giving a prompt relief. Because if this is a progressing myositis, means something related to the muscle degeneration, muscle autoimmune reaction, child may be bedridden or wheelchair bound, and that what I was able to see in this girl. Muscle wasting may begin in weeks, wrist wall involvement of chest muscles, pain may become chronic, schooling and daily activity which is already interrupted. So this is a prognosis. If homeopath is unable to intervene in time, so this is a prognosis. So long-lasting disability. So now we will go to the video analysis of the case. Okay, so everybody, I think everybody is attentive. Yes, Dr. Purushottam Patil sir, you are right. Progressive autoimmune diseases are fatal. In such a way, you should remain active in chat box so that I can know that you are listening to me. Okay, so we are in the point that now we are going to the first consultation. But have anybody has gone through the first consultation? Let me know in chat box the video which I have uploaded and share. First consultation video where I was one by one asking question to the patient. If not, please go through that because this is the first time we are sharing in this manner. Okay, so in-depth video analysis, what I was going to do actually in this session, I was about to analyze this first consultation one by one. But again, that will take the time. I think attendees will go through that as per their convenience. So first, tell me what is the important points in this case. What are the important points that you can see in?
So the Vishal is saying ailments, factors, and its effects on her body. Ailment factors and its effects on the body.
Yes, Vishal, you are absolutely right. Fantastic answer. So in this case, just pains are not important. We are not here. We can't just give the a routine painful remedy like arnica, Rustox, Bryony, and all. Even this remedy might be indicated if that, but we want to share probe this autoimmune link. Okay, so autoimmune triggers are very important. So what are the autoimmune trigger, or what are the potential triggers that you can see in this case mentally? Anyone?
I think Dr. Parshuram is saying muscles wasting.
Yes, ultimately it is affected on muscle. Dr. Parshuram sir from Karnataka. Very good. Trigger. So what kind of state of mind which is ultimately reflected on the body? So this is a psychosomatic correlation that we are here to establish. See, already an eminent rheumatologist has seen this case. We should first of all respect them. When one become rheumatologist, they study MBBS for 5.5 years, then rheumatologist for 3 years. Then after 8 to 10 years of rigorous study, they reach to the degree of rheumatologist. Now we want to think it in some additional way so that we can give such a cases relief, isn't it? So that's why we have to establish this link, that how body is impacted by mind is again impacted by body, and all this together create this kind of disease. So any more responses? Mind, body?
So yes, Dr. Vishal is saying she mentioned about the incident with her father. Her father cried.
Yeah. So those who has not gone through the case, let me quickly tell what exactly happened to this girl. So when I started probing this girl, first of all, she was literally brought to my clinic. She was not able to walk properly on her own. Her mother and brother has supported her, so she somehow entered into my clinic and sat in that chair. If you can see the video later and understand this. So, and basically, she was suffering from very deep muscular pains of both soles, calves, lumbar region, neck, and head. And sometimes even she was screaming from the pain. Cannot perform daily tasks, sports, schools, everything stopped. So you can imagine a situation where this kind of strange and mystic disease has turned the entire life upside down. Now, when I started probing physically, you must have seen that there are some peculiar things. She told me that even if I touch myself, it is painful. So this is a kind of muscular pain. Slight touch, motion, jerks, everything is unbearable. Even cold exposure, cold weather, no, nothing was comforting her, even disturbing her mood. Somewhat relieved by rest and sleep, where uh, even gentle motion means in that state also she was doing some kind of motion. And there was Marathi मध्ये आपण ज्याला चमका म्हणतो, that pains she was describing, right? So this is what we have got physically. Now at the level of mind, yes, any more triggers?
Yes, sir. There are two more answers. Dr. Parshuram again is answering. Parents forcing patient to perform under pressure with stipulated time.
Okay.
And Dr. Pratik is answering mental pressure as well as suppressed anger is also there.
Just a minute. Yes, what Dr. Pratik has answered?
Mental pressure as well as suppressed anger.
Okay. Yes. So imagine situation, mental pressure and suppressed anger, right? So imagine situation of a girl. Now the unfortunate thing happened that I mentioned in the case was everyone was pointing toward her, that there is a possibility that she might go in the same path. This is unfortunately reality of this our Indian society, that many times this kind of decisions has been watched and analyzed by a different perspective. We are not here to discuss on that, but yes, many of us know that the kind of burden, that kind of shame, as even we heard sometime that honor killing is this is the thing that happens all around us. So she also belonging to such a kind of orthodox family, though here she has given all kind of liberty. This is what triggered her. Okay, so the thing happened was her friend's father was saying that this girl, our patient, can perform similar things, that she might also run away, that she might also choose her own partner without informing you, and she be aware. Now this has caused a lot of turmoil in this patient's mind. What this friend's father told, that let's see how she performs in this 10th. देखते हैं ये 10वीं में कैसे परफॉर्म करती है. अगर इसका प्रॉपर रिस्पांस नहीं आया, अगर इसके मार्क्स प्रॉपर नहीं आए, तो इसकी आप शादी करवा दो, ये पढ़ाई से कुछ होने वाला नहीं है. हमने देखा कि कैसे अर्लियर आपके बड़े बच्ची के साथ हुआ. So this exam was not just 10th exam for her. This exam was deciding her entire fate. Everybody is with me? You're trying understanding the thing? Yes, so now sir. You tell me what psychological trigger might be there.
Sir, Dr. Pragati is saying anticipation.
Hello?
Anticipation, anger suppressed. These are two answers by Dr. Pragati Gaikwad. And if we are seeing some more answers.
Yes, elements from judged by others, correct. So how you put it into the words? See, please be attentive. This is going to be very interesting conversation. We are going to continue this for just half an hour more. Okay. So please be attentive. We are going to the very interesting remedy. Dr. Jinali, you are on very right track. Yes. Okay. So long story short, everybody knows about this. Ailments from indignation, is it there or not in this case? Elements from anger, is it not there or not in this case? Yes, I want quick response. Elements from anger, is it there? Elements from anger, is it suppressed or expressed anger? Yeah. Insultation, humiliation. Yes, Dr. Darshana, you're right. So, you know, yes, I know everybody is pointing. Yeah. So let's try to summarize this, all these things. Mind, different elements from anger, indignation, anxiety, lot of anxiety and anger which is suppressed. This is on one side. Now put on physical symptoms. What are the physical symptoms we have? Yes, in the chat box, please. Interesting physical symptoms that we have. I want physical. Now mind is okay. Anybody want to add anything in the mind? More mind symptom? Yes, more mind symptoms. Dr. Rupali case is already there on the group and all. It is shared long. Even this time we have shared mind also. Yes, both physical. Dr. Jinali Patil, you are on absolutely right track. Ambitious. Yes, Dr. Swati, ambitiousness is definitely. If you have seen this case record, there is a word target. You know, many times it comes target. Dr. Radhika Shembarkar, madam, you are also right. There is a palpitation with headache and vertigo. Now the $1 million question is that how was her original nature? Okay. So let's go to the group of remedies directly. Before that, I will tell you, I will share you. Now I am unable to see your chat. So just focus on this PPT. So there are 2-3 issues: anger suppressed, and anger with indignation. So these kind of elements are coming. Please, you can note it, you can understand it, you can add it from your side. So anger with indignation, definitely there is indignation. My best friend's father is telling that she will also run away. So you can imagine an indignation, something which is affecting the self-esteem, isn't it? Blaming someone that the things that she has not done yet, she has not even thought of these things, but she has been into this. She has been accused like this, that she will also run away. This is not only indignation, but anger with indignation. Then there is a lot of anticipation that what will happen to my exam, and that there is anger suppressed, unhappiness, anger with anxiety and all. Okay. Now, with all this mind, please pay attention. I have told this rubric in earlier session also. Please also give proper importance and proper attention to physical symptoms as well. Okay. So general touch, slight touch aggravation is very, very important. Now we have to combine these two. Okay. Now these are some of the words that come in the mind section, that she's a chanchal. So if you see, what is chanchal? Yes. What is chanchal? I think no one here who don't know Marathi or Hindi. If you see the video, there also first स्वभाव कसा है, खूप चंचल है. So what is the chanchal? Dr. Rajshri madam, yes, restlessness, exactly, very good. So in English I have translated as an active and energetic, but chanchal is someone, if someone is just sitting, not talking anything, very dull, very sluggish, will call it chanchal? No, chanchal is something who is not at ease, who is actively doing something. So this word strike me first. Okay. Again, then she someone dislike gossip, overthinking. It is given that she told that she thinks over. Don't interfere with me. These are the words she usually tells. Don't interfere with my, my life. Don't interfere with my routine. Don't ask too many questions. She wants her own space, right? Then she is money cautious also. Very ambitious. Target is the word that came very often. Then too much things. She liked to do too much things, means sports, yoga, dancing, even in the school events and festivals. She's the someone who is in front. Anxiety when expected. It is also marked anger, indignation. Okay. So in between, I will open my so that you can see. Yes. Chanchal, indecisive, fickle, capricious, restless, steadfast. Dr. Simran, good, restless. So, see, we don't want direct, repertory rubric. It is not like that, but it is just an understanding of a human being. Jar आपल्याला कोणतरी सांगत असेल ही मुलगी चंचल आहे, so at least we will not think of calcarea and baryta and graphites and carbovage, right? We want some active, agile, energetic, restless kind of personalities. Yes, activity desire can also consider. See, we are not directly going to the so-called mind method. That is a different way of approaching the case. It has its own benefit and hazards. We are not here. We are going through our classical way. Okay. So chanchalness, that the first thing that I heard from this patient. Now overthinking. Overthinking. Any rubrics that you can tell about overthinking? Many times patient tells us that I overthink. There is so many overthinking. What kind of rubrics we can think? Brooding. Okay, brooding is usually on past, not thinking on the same thing. Yes. Brooding. Brooding is usually same thought repeated. Now overthinking is, okay, I'll tell you, relevant rubric. So this is a relevant rubric. You can write, you can remember, this is the thoughts which are compelling. There is no control over thoughts. Thoughts coming again and again. Thoughts compel to do, compulsive neurosis, compulsive, delusion, compel to do, and neurosis. These are the group of remedies. So you have anacardium, arsenic, hyoscyamus, medullum, black acid, syphilinum, and all. Thought persistent, thought compelling. Yes, this all is very important. So now make a totality. I'll tell you, after hearing this, after hearing that she is very agile, active, she has been good with kids. The mother has told that she's playful in nature, keep playing with small children. And in desire, she told about this non-veg, vegetables, cold drinks, and many more. And have you seen her constitution? She's like thin, tall. This all has brought my first prescription was, yes, any remedy suggestion? We are going a little bit fast because only half an hour remaining. You can directly put the remedy suggestion.
Phosphorus, Nux vomica. These are two remedies.
Yes,
which
Nux vomica, phosphorus. Dr. Darshana, you are right. Phosphorus was the first remedy that I have given. If you have seen the follow-up, I'll stop sharing for a while. If you've seen the follow-up, you must have noted that I have given the phosphorus considering the tall thing. She's into dancing, music, active with children. Though there was some points that are contradicting with phosphorus, I thought initially, okay, and that was not right, okay. Phosphorus don't given her any response. Her pains keep on increasing. She was crippled. The referring doctor was asking me, should we, see other rheumatologists? Should we step up the painkillers? Because in spite of painkillers, in spite of this HCQ and all, she was getting very small relief. So the condition remained as it is. Then I reanalyzed the case. So Nux vomica, very good. Yes. So what is the next remedy? And before going to the next remedy, before going to the final analysis, would you like to see some video of this patient? Hipar-sulf. Yes. Now I will pinpoint differentiate Hipar-sulf, Nux vomica, this all the remedies, Staphylococcus aureus after this. But once again, please watch the patient carefully. I'm sharing my screen now. So after giving the remedy, her ESR, the first indication, the ESR significantly reduced. The pain was significantly, means beyond imagination. She was able to move here and there very comfortably, and all modern medicine was stopped. Okay, I will show you, then you will able to understand the joy that homeopathic physician gets. Before that, I am playing this. Okay. No. Oh. So see, mother, I'll. So now mother is here. So she is explaining what autoimmunity is. She has been very well informed by the rheumatologist. Please listen.
सप्टेंबर पासून थोडासा त्रास होत होता.
म्हणजे थोडंसं ताप आलेलं तिला झालेलं सांग ते
So she's saying that it started with fever.
तापामुळे असं मला वाटतं.
It's a 14.
तुमच्या दृष्टीने त्रासदायक आहे याच्यासाठी.
जी पाय पेन करतात.
So I asked this. So this is the question. What is the most important complaints? What is the chief complaint? What is the main issue you have with this girl, your daughter? So she's saying leg pain,
आपल्या चालाय
एकदम स्लो होते.
can't walk.
त्यामुळे रोजच्या तिच्या रुटीनवर लाईफवर आयुष्यावर काय परिणाम?
So this is again question, how it impacted on your life. See, what happens, we keep on probing mind and mind. Once we enter into the mind, it is like a, entire universe. She's telling about her childhood, friendship, study, and we completely get messed. So we have to ask this question, how this complaint impacts your life. Now listen, if you know Marathi, it's well and good. I will quickly translate. जागेवरच आहे. She is just bedridden. College बंद, शाळा बंद. No college, no school. No classes. Even can't get down from the building. You can imagine the gravity of the case.
समजा आता आपल्या एवढ्या जिनाजवळून खाली गेली तर काय होतं?
I asked, my clinic is on the second floor. So I asked how she came up, what will happen if she goes down from here. Can't walk, severe leg pain.
खाली पण म्हणजे इथनं असं रोडपर्यंत गेली काय मग आता एवढं जाणे होत नाही, हळूहळू चालते आणि मग घरात गेल्यानंतर मग झोपतेच.
And after going to home, she just slipped down.
चालताना चालून घेते आणि नंतर परत त्याचा परिणाम जाणवतो.
So in spite of these pains, if she is compelled to walk, somehow she walk out, and after that there is unbearable pain.
असं म्हणतो.
आणि चालताना पण स्लो मोशन म्हणजे औषध जर असले ना खाली असेल तर जरा बऱ्यापैकी चालते, पण जसं असं कमी होईल ना तशी ती हळूहळू चालते. असं
पेन किलरचा इफेक्ट आहे तोपर्यंत जरासं ठीक असते, त्याचा परिणाम कमी झाला की जाणवतो. आवाजात काय फरक पडलाय? अशा हळूहळू बोलते.
अशी बाहेर आली की नाही.
So actually, see, she was speaking in a very soft language. I thought that whether she has some complaints and pain. That's why I, asked. But mother said that she is talking in this a decent kind of talk. Very much cultured.
घरात
आई कसाच आवाज ओरडते पाहिजे.
हो का? मी दुखते म्हणून
दुखते म्हणून मी बाहेर कुठे असते काय असते तर मला हाक मारण्यासाठी
तर ती तुला ह्या त्रासामुळे तुझ्या मेन रुटीनवर लाईफवर काय परिणाम झाले?
So she is telling that कुठलीच गोष्ट I can't do anything.
परत जेवण पण पहिल्यासारखं जेवण पण जात नाही.
Not eating properly.
चालायची सवय आहे जास्त, एका जागेवर स्थिर कधीच नसते. जास्त अशी बाहेर फिरती वगैरे तसं काहीच करता येत नाही.
पूर्वी फिरण्याचं स्वभाव
म्हणजे असंच खेळासाठी ज्यासाठी गावी राहत होती ना, मग ती अशी अशी चंचल आहे, अशी उड्या बिड्या एका जागेवर.
Now here you can hear she is a chanchal. Udya I mean she is jumping, moving like this.
शांत राहायचं अशी खेळ काय होती.
तेच ह्याच्यामुळे.
See my dear friend, I'll just communicate with you. Okay. See, this is the best learning experience. You have a patient actually talking in her own voice with mother, and then you have to extract the symptoms. Now you would have understood the gravity of the case better. On the page also we can know that yes, she is not talking, not moving, she is not moving, she is not doing tasks. But if you once this kind of patient is in front of you, literally you feel empathetic to her. No, if it would have happened to us, like our daughter, our sister, in the peak of her youth, she has been crippled. So that's why we are putting efforts like this. Okay, so In just 5 minutes, we will see this video and then we will go for the follow-up analysis.
थांबलाय तुझं
लहान मुलांवर खेळायचं म्हणजे तिला असं सवयच असते
खेळायला आवडतं.
म्हणजे असं जास्त मोठ्या मुलं नसली काय आता मोठी जण बाहेर पुढे खेळतायत मग ती खेळते थोड्या.
Now here, mother told that she plays with kids and that, mistakenly guided me to the phosphorus. Phosphorus is someone who is very open, like childlike innocence, diffusion theme. She's well with that.
वगैरे पण असतं एकदम.
नाही कधीतरी जास्त म्हणजे लहान पहिल्यापासून हात पाडलं त्यामध्ये
शरीराची ठेवा नाही हाईट वाढ. ठीक आहे आता.
Now here a mother told interesting thing that she has very good appetite, so much so good appetite that we thought that she's eating so well, then why she's not getting the weight, gaining the weight. Okay, so in spite of eating well, she was not gaining the weight. So this is also one important physical symptom that so she is telling that at 4 times she was eating good. She was doing all kind of what is the so actually this case is good example of first case taking. We will take this topic anytime later, that how to probe the case, how to get information from the patient and form your case. Because see, unless and until you don't have information on your paper, there are little chances that you will reach to a simillimum. Nobody reaches to the simillimum always in first consultation, right? Even our respected Dr. Samuel Hahnemann came here and he started taking the case. It is not the expertise that you will strike the target that is simillimum every time, but at least you should put the sincere efforts. Okay, so here question, what do you like for the food?
फेवरेट आतापर्यंतचे 16 वर्षात तुम्ही जे बघितले पथ्य वगैरे सगळं सोडा.
So here you have to tell them that please keep your guidelines given by doctor. मराठीत ज्याला पथ्य म्हणतो, हिंदी में जिसको हम परहेज बोलते हैं. Because पेशेंट क्या करता है, अगर हम उसको पूछेंगे तो परहेज के बारे में बताना चलता है. जो वात होता है वो पाउटा वाटाना उसके कारण होता है तो वो नहीं खाते, दूध के कारण होता है दूध नहीं पीते. So that is different. We should tell patient that please don't tell that medical things, or there is a flood of social media now time. Every day every one of us is getting messages from our patient that I have seen this reel, whether we should take this combination, this patent, this, that, and that. A big problem, isn't it? So the question is, what your tongue likes? तुमच्या जिभेला काय आवडतं?
बरोबर.
No, mother said non-veg. Okay.
आणि
Bhendi. It's not common, isn't it? Bhendi.
काय आवडतं सांग ना. सांग ना काय काय.
तिला जास्त करून बकऱ्याचं चिकन
ओके.
Okay.
मच्छी आवडती आणि
भेंडी किंवा भेंडी किंवा भाजी असली शेपूची वगैरे.
So bhendi, shepuji baju, these are the vegetables which are usually considered very healthy and good for health, but not taken by kids. Usually disliked by kids, but she like is bhendi, shepuji.
चव कुठली बरी वाटते? चव तिखट गोड आंबट खारट.
You should ask a open-ended question. What taste you like? Please don't prompt that whether you like sweet. No.
आवडतं.
Okay. Now this is a now we will take this last question. I asked about thirst. See what mother is answering. She is taking small quantity of water often.
कानाची काय तक्रार आहे बाकी? कान.
Okay. So this is
नावाचा विषय
असं कधी येत नाही एवढा व्यायाम करते ना पण असं दुसऱ्याला कसं कीड जास्त असल्यावर लगेच जायला
she's telling that she does a lot of exercise, yoga. She has won the awards for good flexibility of the body. Okay.
कोण
3 महिन्याची मुलगी माझी सख्खी पण एवढी बरोबर परीक्षा पहिल्या दिवस त्या दिवशी ती आली.
So she fall ill on the day of exam.
आणि पण असं मध्ये गेलं होतं पण कसं ती जरा खूपच क्लोजली बोलायची ती अक्षरशः कॉलेजमध्ये काय झालं म्हणजे असं
So these are the all incidences, unfortunate incidents that we have already discussed. Okay. Okay. So I think you have got good glimpses of the patient here, her condition, her all incidences, physical symptoms. Okay. Physical symptoms. No response for the phosphorus. What is the remedy now? Final. Yes. We are on 20 minutes remaining. Yes. After in the follow-up, I need to show you this also. Yes. That what happened in the follow-up. Ready for follow-up?
Yes, sir. You can show it up.
And then we'll go to the right remedy. Hello, everybody is understanding the thought process. Physical symptoms, autoimmune disease, crippled patient, no relief, biometeorologist medicine to the follow-up. Please pay attention. Please get habituated using the chat box of this Zoho, because in the upcoming section also we want your 100% participation. You know, the remedy which is I am going to tell you, there are n number of YouTube videos and Instagram reels and you know, tweets you can get on the internet. But why this learning is very important and very different, because we are giving you a workshop like experience. Workshop means you work in it and then you try to arrive at the remedy. We provide you the case, the video, the reports, the everything about patient, and then you just feel like this patient is sitting in your own clinic, and then you will reach to the remedy and you can apply it. Okay. So please put a yes in the chat box in the question and answer, and I will move forward. Yes, please try to use the Q&A. Okay. Now I am here with the PPT. First, I'll show the follow-up reports. Yeah. So in the follow-up, you can see her ESR. How much was ESR initially? Anyone can recall? ESR. What was the initial ESR? It was more than 65. Okay. Now it has all the way came down to the 40. This is the first indication. Okay, but this is not only indication. Most important, the patient was suffering from unbearable pains, muscular pain, and now we will see follow-up of that. Please be attentive. This is the important part of this case. Now, see, this is a patient. I asked, how is your condition? She's telling, I am much better now. आता मला खूप बरं वाटतंय. त्रासच होत नाही. I don't have complaints now at all. So actually, she is accompanied by her cousin sister, who was always asking me then when it will get cured. So I, you know, in a light tone, ask how it got reduced. What changes you noticed? काहीच दुखत नाही. I have no any pain now. No any pain. Okay. Actually, I have blurred the face, or you could have, you know, watched the joy of this patient.
मला सांग त्याचं तुला धडधड जास्त होती का त्याचं प्रमाण किती?
So I ask other symptom about this palpitation. How is your palpitation? She's telling that it is no more.
And samka?
That's samka. That's severe pains, sudden pains. I asked, do you want to go to college? She said, yes, I want to go to college.
कधी का सुरू केलंस मला सांगितलं ते सुरू करू नको गडबड करू नको
So I'm telling, I know this kind of young patient get very enthusiastic. You know, once their pain subside, they have to run for their normal life. So I tell them, just please wait for some time, because this is a severe chill. Nowadays, winter is at its peak. So I'm also cautious. But in this peak winter, if she's telling this kind of improvement, definitely we have strike the minimum.
माहिती आहे सुरुवातीला कॉलेजला गेली 4 मधले चढले तर परत झाले कारण ते आमच्यासाठी पण चॅलेंजिंग आहे बघितलंस तू आधी कंडिशन कशी होती कंडिशन
I'm asking her sister that please give proper attention to her. Don't be hurry to resume the daily task.
डोकं दुखायचं काय प्रमाण
कमी आले पण आहे
She is telling the headache is still there. It is reduced. कमी आलंय पण अजून थोडा आहे.
एकंदरीत चांगलं वाटतंय तुला मग त्यामुळे काय काय करतेस ऍक्टिव्हिटी ज्या पूर्वी करत नव्हतीस तू
जास्त जरा एक खायचा जरा जास्त करते.
अच्छा
Then there is another follow-up video that we will see, just 30 seconds. Please pay attention. Now she is moving her hand freely. Okay.
तुला असं बसल्यावर चमकायचं म्हणायचे ना
Actually, I have earlier video sitting in the same position telling about her pains that I have played, but now I have asking about her about pains.
कुठे आहे चमका कसं आहे तुझं काय होत नाही गुड छान गोष्ट आहे कसं वाटतंय एकंदरीत तुला
So here we can really understand that with the right minimum, you know, her severe pains has been reduced, ESR is reduced, CRP is normal, and most important, we have stopped completely HCQ, 𝐻CQ, nothing, not a single medicine she is taking. I will not yet label her as a complete cure. Why? Because there are sometimes, you know, triggers and waxing and waning, but there is a decided relief. So much decided, report wise also and symptom wise also. Then in between, you know, mother told me that we have, you know, I mean, nervous bolla hota eka devala, you know, 𝐂𝐚𝐬𝐞. There is a long way from my city. There is a religious place where they have, you know, put. This is a disturbing incidence for entire family. So in a helpless situation, in some superstitious nervous was there. So they took her all the way, overnight journey to that place and return next day. Then she had some recurrence of pains. Okay. I was telling them that please don't go to this place in this winter, but they haven't listened. They were like, you know, it is due to this religious, they're praying, and this is true also that she has got some relief. So we want to clear that nervous. And then she got some recurrence. Okay. But she is much, much better. Okay. So in last 15 minutes, we straight away go to the remedy. Now I'm going to my final part of PPT. Okay. So before there was severe pains, now there is none. Walking unable to move, now walk normally. Sleep is disturbed, sleep is better. ESR is reduced. CRP is just mildly raised now, and medicines are totally stopped. This is important. Totally stopped medicines. Okay. Follow-up video you have already seen, right? Now we will have open discussion about remedy, and we will see the remedy PPT. So in the chat box, please, final remedy selection. Have you understood the case? Homeopathy has given literally new life to this girl. Single remedy, classical method, pathophysiology and mind, not only mind, not only body, combination of two, uncommon, peculiar. Please be with your remedy. Last 10 minutes. Hello, everyone. Remedy, please. Yeah, wonderful. Megha, yes. Staphylococcus colocin. Now, see, Staphylococcus aureus is a natural choice. I was seeing the wonderful reply by some of our group members. So Staphylococcus aureus is natural choice here. Okay. It has insult, it has indignation, it has oversensitiveness. So remember the word from Phatak about Staphylococcus aureus. Type in, please keep eye on this question answer. Pathologically sensitive, isn't it? So that fulfills the demand, fulfills the condition of this patient. Pathological sensitive means she was not able to tolerate the even touch of her own. That is one thing. Physical touch and mentally also. Trigger touch causes a lot of anger, indignation. Now, but there are some thin hairline differences. Staphylococcus aureus has been suppressed for a long. You know, we see this girl is doing excellent in academic. You know, she is on the stage during events, festival, competition, and whenever her sister is, sister is scolding her, she was saying, "Do your own business, don't interfere with me." So she is very abrupt, straightforward talk. She is not suppressed throughout like Staphylococcus aureus. Yes, there is an incidence, but for that incidence, she thought, उसने ये सोचा कि ये मेरे फ्रेंड के फादर है और ये मेरे फादर को बता रहे हैं, तो इस सिचुएशन में जब घर में ऑलरेडी टेंशन चल रहा है तो ये ठीक नहीं होगा कि मैं उनका इंसल्ट करूं, उनको फाइट बैक करूं. ओके. And again, physically it is a thirsty remedy, that our patient is thirsty, but Staphylococcus aureus is usually thirstless. Okay. And she is very target oriented, active. Staphylococcus aureus कैसे होते हैं, वो कहीं भी बोलती नहीं. No, as actively stage and all, इसमें उनका activity बिल्कुल भी नहीं होता. वो throughout suppressed, mild, meek, non-expressive, करूँ या ना करूँ इस kind में रहते हैं. झिझक, hesitation, ये throughout Staphylococcus aureus में आपको adult age में भी बहुत clearly दिखेगी. So that's why I have ruled out Staphylococcus aureus here, in spite of being very close. And physically also आपको ये physical activity, sudden manifestation, convulsions, shrieking and pains के कारण ऐसे चिल्लाना, इसमें Staphylococcus aureus नहीं है. Okay. So Staphylococcus aureus is very good choice, but thirstiness and all this kind of activity in Staphylococcus aureus miasm wise, basically anyone, what is the miasm of Staphylococcus aureus? Please be active on the question answer. We have just 10 minutes. Dr. Darshana, okay. Now, of course, we should again differentiate Natrum here. Okay. Natrum has this kind of emotional trauma reflecting the physical. Natrum में ऐसा होता है कि emotionally traumatic हो जाने के कारण physical symptom आती है, right? This is true. Again, it is true that there is a lot of self-respect, self-esteem. They will not listen to anyone. And ये इसके बाद जैसा उसने sister से behave किया है, reluctant to talk, hatred to person who has offended him. Yes, it is a natrum. Okay. Then what are the points that are not pointing toward natrum? Anyone? Yes. You can add many points. Yes, also natrum is there in anger, indignation and all. See, natrum दूसरों को इतने abruptly कट करना, जैसे कि do your own business, don't interfere with mine, especially sister को, doesn't get hurt and doesn't like to hurt others. ये लड़की जो है ना, वो पहले से दूसरों को बहुत ही क्लियरली बोलते हैं. मैं वीडियो पे आपको दिखा सकता हूँ, but it will get time. इसमें वो clearly, you can watch it. It is we have uploaded on the YouTube link provided to you. It is an unlisted link, means you will not able to see it directly on my YouTube channel, but you can access to link only for the privacy. Now the point is that ये ये natrum जो होते हैं वो क्या करते हैं, किसी को डिस्टर्ब नहीं करते, शांत रहते हैं, ऐसे एब्रप्टली नहीं बात करते, सल्की हो जाते, मीन्स बोलना कम कर देते. Okay, so this is what the difference is. Yes, she is an extrovert person. You are right, Rupali Patil madam. Psychotic. So Staphysagree is psychotic. That is the differentiation. This is not psychotic girl. This is more of a tubercular, psoric to tubercular girl. Patient is chilly. Yes, Dr. Megha. Patient is chilly. Then how we can tell? We can say natrum mood. Kali iode is from coming from Sonali and all. Kali iode is a syphilitic, destructive. You know, it is as close as mercury. Kali iode is for rheumatism, but the patient is very much, you know, routinistic. Kali all, we have seen the Kali group recently. Okay, so no interaggravation, no aggravation by slight touch in natrum. Very good, Dr. Pratik. So here we differentiate upon natrum. So what is the remedy? Come on. Chamomilla is extremely close here. Chamomilla is this kind of shrieking from pain. But chamomilla is a चामोमिला में क्या होता है, एक तो हॉट भी होते हैं चामोमिला, कुछ भी सहन नहीं होता, पेन सहन नहीं होती, हीट भी सहन नहीं होती, एंगर भी सहन नहीं होता, और वो जोर जोर से चिल्लाने लगते हैं. यहाँ तो उसने पूरा कंडीशन देखकर उसने फैमिली के डिग्निटी के लिए ग्रेसफुली कंट्रोल किया है. चामोमिला किसी के सामने इतना चुप बिल्कुल नहीं बैठता, जो कुछ है उस पर वो स्पिट लाइक एंगर थ्रो कर देता है. ओके, सो यस शी हैज एन, एंड ये थोड़ी सी ऑर्गेनाइज कंट्रोल है ना, उसके टारगेट वगैरह है. चामोमिला ऐसे टारगेट वगैरह कुछ नहीं, लाइक चाइल्ड हु इज नॉट एबल टू कंसोल एट ऑल. सो द फर्स्ट आंसर, नक्सोमिका का डिफरेंशिएट करना बहुत इंपॉर्टेंट है. नक्सोमिका इज वेरी मच क्लोज हियर, यू नो. आई वाज अबाउट टू गिव नक्सोमिका बिकॉज नक्सोमिका में ऐसे टारगेट एम्बिशन ओरिएंटेड रहते हैं, ऐसे एंगर क्लियर कट रहता है, लेकिन नक्सोमिका और इसमें थोड़ा सा फर्क है. ओके, आपने जब देखा होगा बात कर रहे हो कैसे एकदम रिस्पेक्टफुली, ग्रेसफुली, एकदम सिविलाइज्ड मैनर में बात कर रही है, राइट. उसमें अंदर एग्रेशन है, एक प्रकार का एब्रप्टनेस है, लेकिन बात एकदम क्या कहते हैं उसे, एटिकेट वाइज जो बोलते हैं ना, उस दैट देयर इट इज डिफरेंट. एंड नक्सोमिका में थर्स्ट जो है वो बहुत ही लेस होती है, यहाँ थर्स्ट बहुत ही हाई. ओके, दिस इज अ डिफरेंशिएशन. मैग्नीशियम कार्बोनिकम तो बहुत ही डल स्लगिश होते हैं, कार्बोनिकम में होते हैं. इग्नेशिया इज वेरी क्लोज विशाल. इग्नेशिया इज, यू आर राइट. इग्नेशिया में ऐसे, लेकिन इग्नेशिया में क्या है, मूडीनेस होता है. मूडीनेस मीन्स फ्लक्चुएशन होते हैं, और इग्नेशिया इंपल्सिव एक्सप्लोसिव काइंड ऑफ होते हैं. ओके, और अगेन इग्नेशिया में भी थर्स्ट लेस रहती है. सो रेमेडी which is first told, I will like to congratulate Dr. जिनाली पाटिल, जिसने केस पोस्ट करने के बाद इमीडिएटली रेमेडी बताई थी. ओके, और यहाँ पे और रेमेडी बताई है डॉक्टर दर्शना मंत्री. यस, तो the remedy which helped this girl is nothing but our day-to-day arsenic album. Yes, you are hearing it right. Arsenic album. In few minutes you will realize like why arsenic. Okay, so एक जनरल ये इसका एनालिसिस है जो आप यहाँ पे देख सकते हैं. यू नो, स्लाइट टच का इश्यू होता है, थॉट्स कंपेलिंग, मेंटली देखो, फिजिकली देखो, आपको सब जरा दिखेगा. ये एक टॉल थिन काइंड ऑफ कॉन्स्टिट्यूशन है ना, और उसको जस्ट स्लाइट टच भी टॉलरेट नहीं होता. जनरल मसल पर हम एक्शन देखे तो फाटक में 24 रेमेडी दी है, जिसमें जैसे कि बेलाडोना किसी ने बोला था, बेलाडोना इतना यू नो एकदम लाइट, अनसीरियस, लैक ऑफ रिस्पॉन्सिबिलिटी काइंड ऑफ होता है. ये एग्जैक्टली अपोजिट है, बेलाडोना नहीं है. ओके, शी इज वेरी ऑर्गेनाइज्ड, रिस्पॉन्सिबल गर्ल. सो इसमें स्लाइट टच एंड श्रिकिंग विद पेन्स, ये चीजें हम मिस नहीं कर सकते. तो मैं आपको एकदम रियल बताता हूँ. ये पेशेंट जब सामने होता है ना, तो मैंने बिल्कुल आर्सेनिक तक नहीं पहुंचा. तो मुझे लगा था एक पॉइंट, जब मदर ने चंचल, सी इफ यू ट्रांसलेट, अगर हम चैट जीपीटी को बताओ ट्रांसलेट चंचल इनटू द मराठी, तो रेस्टलेस आएगा, यू नो. सो पहले उधर ही पेशेंट ने क्लू दिया था, लेकिन आई मिस एग्जैक्टली लाइक यू. to error is human. Please remember this suvichar. Error is human. So don't get discouraged at all. लेकिन क्या हुआ, उसको फास्फोरस दिया, थोड़ा फर्क नहीं आ रहा था, मैं भी वेट कर रहा था, इतनी बीमारी। एक रात को उसने मुझे फोन किया, रात को 11 बजे। I thought what happened to this girl, इतने रात को फोन किया है। तो उसकी मदर ने कहा देखो ना वो कैसी कर रही है, उसको बहुत तकलीफ हो रही है। मैंने कहा क्या हुआ है? उसको मेंस्ट्रुअल पेन्स हो रहे हैं और वो इतनी पैनिक है। देन आई थॉट फर्स्ट हम सोचते कि फोन कट कर दो ना, रात को क्यों फोन लेना, बट यस एज अ रिस्पॉन्सिबल फिजिशियन ये हमारी ड्यूटी है। तो मैंने उसको कहा 2 कॉल, तो फोन पण डॉक्टर खूप त्रास होतोय, काय माझं म्हणजे राहते की नाही असं वाटायला लागले, काहीतरी करा प्लीज। आता काय करू शकतोय? नाही काहीतरी करा आणि आईकडे फोन दिला, डू समथिंग। Then I told her mother that please come tomorrow and all. Then at night I keep on thinking. So this is an uncommon, expression that when there is a lot of insecurity about this in this patient, and this patient anxiety when strike overwhelms her, then she compelled the other that please do something, take me to the clinic, hospital, exactly like we have read in our textbooks like Dubai and all. Okay, so there I got a strike about she's a tall, she's a chilly, she's a thirsty, she has this kind of muscular pain, shaking from pain, she's very fair, organized, target oriented, no nonsense, don't like gossip. Then I connected the dot and then I reached to the arsenic. Okay, now I am presenting this totality to you retrospectively. So congratulations Dr. Jinali, and please pay attention to this concluding part of today's session. Next part, this is called aggravation, burning pain, fastidious, critical, sudden violent episodes, prostration after health anxiety, ये सब होते हैं. Okay, now I will take you to the beautiful PPT prepared by Dr. Dhanashree, at least from 10 books. Okay, so this is a long PPT. And after getting some points from this PPT, you will never ever forget this wonderful remedy. This is a PPT of 17 slides, 70 slides. We are not going to take this much of slides in the 10-15 minutes. Dr. Bharti, hello, are you there?
Yes, sir, I'm here. Hello, I'm here, sir.
Radar team. Hello. Jaspal ji is there. Okay, so I'm asking whether we can extend for a few minutes. Dr. Bharti, Jaspal ji, let me know quickly. Okay, I'm continuing for next 10 minutes. No response from Dr. Bharti. So time and again we have been hearing that arsenic patient is compared with race of horse, and pulsatilla with sheep, and antidote is swine. Chanchal, horse. Horse is someone who is a girl that playing yoga, dancing, swimming, everything. Okay. The women used to take it for purpose of beautifying the complexion, and men indulge into it because it enables them to work hard with a little or no fatigue. So you can imagine, okay, little or no fatigue. The sphere of action. So ये जो आर्सेनिक है ना, ताकत बढ़ाने के लिए पावर के जैसे यूज करते थे, ऐसा दिया है लिटरेचर में. इन द गुड ओल्ड डेज व्हेन दे यूज्ड टू गो इनटू द ओशन, there they took arsenic, and while after returning they found themselves to be in more power, more strength. So arsenic is directly like a booster. This all kind of sphere of action will now go into the details, constitution, ओवरसेट राइट, मिडनाइट. सो ये बहुत ही इंटरेस्टिंग दिया है कि कई बुक में कैडावरस ऑर्डर जो है ना, सो अंदर से पेशेंट बहुत ही अगली होता है, हार्श होता है, रफ होता है. डूज द क्राइम विदाउट एनी रिमोर्स, ऐसे कुछ सेंटेंस है इसमें. ओके, सो यू कैन इमेजिन ये अंदर से होता है, लेकिन उसके लिए प्रेजेंटेशन बहुत इंपॉर्टेंट होता है। आर्सेनिक को नक्सोमिका को अगर गुस्सा है तो पूरा वो बवाल खड़ा कर देते हैं, नो चेयर्स, जोर जोर से चिल्लाना, क्रिएटिंग अ सीन। आर्सेनिक बिकॉज फॉर देम प्रेजेंटेशन इज स्टिल इंपॉर्टेंट, सो वो खुद को उतने हार्शली एक्सप्रेस नहीं करते। फ्रस्ट्रेशन है, मैं अभी गैंग्रीन तो हम सबको पता है, ओके। सो यू कैन इमेजिन कैडावरस ऑर्डर, गैंग्रीन ये अंदर रहता है, बाहर भी। मैं फिजिकल पार्ट थोड़े स्किप करता हूँ, डॉक्टर धनश्री ने बहुत ही एफर्ट से किए हैं। 70 स्लाइड्स है, यू कैन इमेजिन फ्रॉम 10 बुक्स। हम कभी लेंगे ये कॉलरा का कंपैरिजन, वेरी ब्यूटीफुल कंपैरिजन, ओके। विल गो टू द माइंड बिकॉज दिस इज इंपॉर्टेंट। मोडालिटीज ये भी इस केस में आप देख सकते हो कि जैसे ठंडा उससे उसको कंप्लेंट ज्यादा बढ़ती है, वार्म से एमुलरेशन है, ओके। नाउ ये जो इरिटेबिलिटी पेन ड्यूरिंग है, ये बहुत ही अच्छे अच्छे प्रकार से ऑथर ने दी है। इग्नेशिया जो है ना, वो अपनी इरिटेबिलिटी मॉरल्स के कारण पूरी हाइड करते हैं, और आर्सेनिक भी हाइड करते हैं बिकॉज उनको प्रेजेंटेशन इंपॉर्टेंट होता है, राइट। सो जब बात करते हैं डॉक्टर खूब पुन्हा दुखाया लागलंय, दिस इज काइंड ऑफ टोन समटाइम्स, बट एक बार वो अपने आपे से बाहर हो जाए तो वो भी एग्रेसिव हो सकते हैं, ओके। अभी ये बहुत ही माइंड, सो कॉल्ड माइंड मेथड में बहुत अच्छी तरह से बाइटिंग टम्बलर की एक रूब्रिक एक्सप्लेन किया है। तो उसमें ये है कि जो उनके क्लोज होते हैं, टम्बलर मींस द दैट पॉट वेयर वी टेक्स द वाटर, ओके। आई विल एक्सप्लेन दिस with the video graphics, just a minute, okay। so biting tumbler ये आपने माइंड के बहुत सारे रूब्रिक में पढ़ा होगा। टम्बलर मींस पॉट। सो ये पॉट से मैं पानी पी रहा हूं, ये पॉट मुझको पानी दे रहा है और मैं इसी को बाइट करता हूं। इन द सिमिलर वे दे टेंड्स टू टॉर्चर, दे टेंड्स टू पुट देयर एग्रेशन ऑन दोज हु अराउंड हिम। आप इमेजिन करो, ये मदर, इसकी मदर है, उसके अच्छे से केयर ले रही, उसको ही वो प्रेशराइज करेगी, टॉर्चर करेगी, रिपीट करेगी, बार बार उसको कंप्लेन करते रहेगी, मुझे ये हो रहा है, हो रहा है, हो रहा है। बाइटिंग हिज टम्बलर, इन दिस कॉन्टेक्स्ट आपको ये समझना है। वही इग्नेशिया वगैरह होते हैं, वो दूसरे के लाइफ का भी अच्छी तरह से दूसरों को भी थॉट करते हैं। आर्सेनिक थोड़ा सा सेल्फिश, सेल्फ सेंटर्ड, ग्रीडी, अवराइस, ये सब आते हैं, यू नो, माइजर, ये उसमें आते हैं। सो मॉरल फीलिंग वांट ऑफ में आर्सेनिक है। डिस्पोजिशन टू बिकम, सो ये मैं आपको आर्सेनिक की अदर साइड बता रहा हूँ। डिस्पोजिशन टू बिकम क्रिमिनल विदाउट रिमोर्स, क्वाइटेड कैन नॉट बी क्वाइटेड अंटिल कैरिड, यानी जब तक उसको हम स्पेसिफाई नहीं करते हो तो सुनता नहीं, वो रिपीट। अभी आर्सेनिक के क्लिनिक के कितने सारे एग्जांपल आप बता सकते हो। हमारे असिस्टेंट को पूछेंगे कि इसमें मेडिसिन डाली कि नहीं, यू नो, दे आर मिसट्रस्टफुल होती, वो मिसट्रस्टफुल होती। लेकिन ऐसे बहुत सारे पेशेंट पूछ सकते हैं, एक वर्जन पे हमें नहीं जाना है, ये भी मैंने आपको बताया, ओके। फैस्टिडियस तो है ही, रेस्ट कैनॉट रेस्ट व्हेन थिंग्स आर नॉट इन प्रॉपर प्लेस। फैस्टिडियसनेस, आपको उनकी फाइल, वो जो आपके सामने फाइल रखेंगे ना, तो अभी उधर ही पता चलेगी, इतने नीटली सभी थिंग्स ऑर्गेनाइज होते हैं। लेकिन एंटायर मिनरल किंगडम फैस्टिडियस में आता है, तो आप वैसे जनरलाइज मत करो, बट यस इट इज अ फैस्टिडियस। एंड एंजाइटी व्हेन एनीथिंग एक्सपेक्टेड। सो दिस इज द लास्ट रूब्रिक, आई विल एंड इट हियर। अभी इस पेशेंट को, इस केस में ये सबने एक्सपेक्टेशन डाले थे कि देखो 10वीं में क्या करते हैं, हाउ शी विल परफॉर्म इन 10th, लेट्स सी वो 10th में कैसे परफॉर्म करती है। सो एंजाइटी व्हेन एनीथिंग एक्सपेक्टेड। नाउ अभी जैसे कि हमें रडार ने प्लेटफॉर्म दिया है, तो मैं रडार से आपको ये रूब्रिक बताना चाहूंगा। सो ये सी एंजाइटी व्हेन एनीथिंग एक्सपेक्टेड, कैन यू सी दिस आर्सेनिक, एंड इट इज गिवन इन केंट। सो यहाँ रडार में आप ये ऑथर भी देख सकते हैं यहाँ पे। If the Kent has added in this rubric, so definitely this is important, okay। और रूब्रिक में आपको बाकी के भी यहाँ पे यही बता देता हूँ, आपके सामने पूरा रेपर्टाइजेशन है। माइंड का थॉट कंपेलिंग मैंने बताया, एंगर विथ इंडिग्नेशन, स्मॉल ग्रुप ऑफ रेमेडी, स्टाफिस अग्रिया, कोलोसिन, यहाँ भी आपको आर्सेनिक दिखेगा, ओके। देन एंजाइटी अबाउट टू हेल्थ है। अभी एवर्जन टू मीटिंग ऑफ फ्रेंड whom he imagine he has offended, अभी लोगों से वो मिलना बंद कर देता है बाद में, जब उसके इमेजिनेशन में चला जाता है, जैसा कि बाद में नेचुरली वैसे नहीं है, राइट। सबसे इंपॉर्टेंट वन रुब्रिक ऑफ आर्सेनिक विच यू शुड नेवर फॉरगेट इज सेंसोरियस क्रिटिकल. प्लीज राइट डाउन, रिमेंबर. ये पेशेंट होते हैं वो बहुत ही एब्रप्टली बोलते हैं, दूसरों के माइंड का थॉट नहीं रखते, दूसरों के मन का विचार नहीं रखते. यू नो, कभी कभी कुछ रेमेडीज है जैसे कि पल्सेटिला है या समटाइम्स नैट्रमूर है, उनको लगेगा कि दूसरों को तकलीफ ना हो, लेकिन ये आर्सेनिक और सल्फर है ना, वो जो है वो मुंह पे बोल देते. सेंसोरियस. सेंसर बोर्ड होता है, आपको पता है सेंसर बोर्ड. सेंसर बोर्ड क्या करता है? वायलेंट का सीन कट, सेक्सुअल सीन कट, रिलीजियस सीन कट. सो कट करना, ये सेंसोरियस. सो इनको भी दूसरों को क्रिटिसाइज करने में कोई भी झिझक नहीं होती. अगर आप आर्सेनिक को पूछोगे, आप अगर आपके फादर आर्सेनिक है, आपने कुछ अच्छा होमवर्क वगैरह किया है, फादर को पूछो फादर कैसे हुआ है, यस ओके, इससे अच्छा भी हो सकता है, ये पॉइंट तुमने गलत किया. सो स्ट्रेट अवे ब्लंट रिप्लाई देते हैं, इवन विद डियरेस्ट फ्रेंड. ऐसा भी इसमें रुब्रिक है. सो रडार में आप देख सकते हैं सभी रुब्रिक्स. फिजिकल सिम्टम आप सब देख लो. देखो टच, स्लाइटेस्ट टच, ये तो मैंने आपको बहुत बार बताया है. पेन, सडन पेन्स, इसको जो चमका होते हैं ना. कॉन्वोलेसेंस, कैन एनीबडी टेल मी मीनिंग ऑफ कॉन्वोलेसेंस? कॉन्वोलेसेंस मींस रिकवरी पीरियड. इसको क्या हुआ है? फीवर हुआ है, फीवर के बाद बीमारी चलती रही है. so उसमें कार्बोवेज वगैरह रेमेडी है जो हम यूज करते हैं. मसल कंप्लेंट, एक्टिविटी फिजिकल, देखो कितना ब्यूटीफुल रूब्रिक है. फिजिकल एक्टिविटी, आर्सेनिक, कोका, ओपियम, फॉस्फोरस. यहाँ पे आपको बाकी कुछ नहीं मिलेगा, स्टाइफिस वगैरह नहीं, नाइट्रमूर नहीं, कोई नहीं. आर्सेनिक रस्टॉक्स मिलेंगे. सो दिस इज अ स्मॉल ग्रुप ऑफ रेमेडी जो उसकी माँ बता रही है कि ये सब एक्टिविटी करती है. आप फिर के जाकर पढ़ो तो आपको ये बहुत अच्छे से समझ में आएगा. ओके. उसके बाद बहुत सारे डिल्यूजन है, सीज थीव्स, उनको एक तरह की एकदम इनसिक्योरिटी रहती है. ये खुद के चाइल्ड पर भी भरोसा नहीं करते. इफ देयर इज एल्डर आर्सेनिक, वो इतने मिसट्रस्टफुल होते हैं, उनको ये लगता है कि अगर मैं मेरी पूरी फाइनेंस मेरे खुद के सन को दे दूं, खुद के डॉटर को दे दूं, तो वो कल मुझे घर से बाहर निकाल देंगे. यू नो, आपके पेरेंट्स को कई लोग ऐसे एडवाइस देते, देखो आप सब बच्चे को दे रहे, कल ये आपको ही कहीं घर से ना निकाल दे. दिस काइंड ऑफ एडवाइस आर यूजुअली गिवन बाय मिसट्रस्टफुल पेशेंट. आर्सेनिक आर वन ऑफ देम. ओके. इनसिक्योरिटी, डिपेंडेंसी, ये तो आपको पता है. डिपेंडेंसी, पॉजिटिवनेस. आर्सेनिक ये सेल्फिश है, टेकर है, नो, लेने वाले हैं. सल्फर ये देने वाले हैं. सो बहुत ये इंटरेस्टिंग पॉइंट है, फास्टिडियसनेस, ऑर्डर एंड सिक्योरिटी. लेकिन ये हमें कंक्लूड करना पड़ेगा. बट ऑल इन ऑल आई थिंक थिंग्स आर क्लियर टू यू. नेक्स्ट टाइम आपके ओपीडी में ऐसा पेशेंट आए जो इस तरह का बिहेवियर करता है फिजिकली, इस तरह का बिहेवियर करता है मेंटली, तो आप ऐसे जानोगे. मैं आपको फिर से एक बार रडार की तरफ लेकर जाऊंगा. ओके. जिसमें आपको ये सारे रूब्रिक्स मिलेंगे देखने को. यहां आप एक इंटरेस्टिंग अच्छी चीज क्या कर सकते हो, आप ऑथर चेक कर सकते हो. अभी एंजाइटी अबाउट हेल्थ. ओके. सो यहाँ पे मैंने क्लिक किया तो ऑथर आ जाएंगे. जस्ट अ मिनट. यस, करेक्ट. सो ये आप ऑलवेज प्लीज सी द ऑथर, बिकॉज क्या है, बहुत बार अनरिलायबल ऑथर से थिंग्स एडिशंस होते हैं तो वो हम नहीं देखते. अभी एलिमेंट्स फ्रॉम कौन कौन से, यहाँ भी एक अच्छे से हम सर्च करते हैं एडवांस सर्च में. यहाँ पे अगर मैंने सिर्फ एलिमेंट्स डाला, ओके, एलिमेंट्स, और आर्सेनिक तो वहां डाला है. सो आर्सेनिक के कौन कौन से एलिमेंट है वो सब यहाँ पे आ गए. ओके, कैन यू सी दिस एलिमेंट्स? दिस इज फ्रॉम केंट. एंगर, वेक्सेशन, एंगर विथ एंजाइटी, एंगर विथ ग्रीफ. और सिंथेसिस में तो है ही, स्पेशली जिस इस केस का जो सबसे रिलेवेंट था, इसमें गुस्सा भी था और इंडिग्नेशन भी है, वो सब यहाँ आपको देखने को मिलेगा. सो प्लीज रिमेंबर दिस फिजिकल रूब्रिक्स ऑल्सो, मेंटल रूब्रिक ऑल्सो. और एक चीज मैं आपको बताना चाहूंगा, पेशेंट खा रहा है, बहुत अच्छी तरह से खा रहा है, लेकिन वेट गेन नहीं हो रहा. सो उसमें रूब्रिक है, अभी मुझे रूब्रिक याद नहीं है, मैं सिर्फ यहाँ पे कीवर्ड डाल रहा हूँ. ईटिंग वेल, ओके, इमेसिएशन दो ईटिंग वेल, ओके, एपेटाइट, रेवेनस. यहाँ पे भी आपको आर्सेनिक देखने को मिलेगा, राइट. आर्सेनिक, ओनली 43 रेमेडीज. और फाटक में तो इससे भी लेस होगी, मैं देखता हूँ. इमेसिएशन, Association. ओके, पाठक में भी हम ढूंढ सकते हैं, लेकिन यहाँ पे आपको सबसे इंपॉर्टेंट रेमेडी मिले, चिल्ड्रन में भी आप देख सकते हो. ओके, सो दिस इज द रेपर्टाइजेशन फिजिकल, दिस इज द रेपर्टाइजेशन माइंड, एंड माइंड प्लस बॉडी दोनों हम एक साथ देखते हैं. ओके, यहाँ पे आपको माइंड एंड बॉडी दोनों देखने को मिलेगा. यस, सो प्लीज सेव दिस screen, you can take the screenshot, you can study this rubric. बट मैं फिर से आपको बता रहा हूँ, ये मैंने रिट्रोस्पेक्टिवली स्टडी किया. पेशेंट था, कैसे मुझे आर्सेनिक क्लिक हुआ प्रैक्टिकली क्लिनिक में, ये भी मैंने आपको बताया. इतने सारे आर्सेनिक के केसेस है. ये इट इज अ डे टू डे रेमेडी. मीन्स मैं शेयरिंग स्टॉप कर रहा हूँ. ओके, लास्ट 5 minutes वी आर कंक्लूडिंग. सो ये आर्सेनिक आपको डेली देखने को मिलेगा. आर्सेनिक वेजिटेरियन डाइट, ये एक आर्सेनिक का इंडिकेशन है, which was exactly opposite in this case. This is exception, but most of the arsenic prefer vegetarian diet. ये किस बुक में दिया है? Anyone who has given about this vegetarian aspect of arsenic? Only one book, उसमें वो बहुत अच्छी तरह से दिया है कि while proving ये आर्सेनिक जो है ना, वो वेजिटेरियन ईटिंग लोगों में अच्छी तरह से मींस प्रॉम्प्टली प्रूव हुई है या ज्यादा मिली है. दैट्स व्हाई ये नक्सोमिका और आर्सेनिक का एक मेन डिफरेंशिएशन हम बताते हैं. नक्सोमिका नॉन वेज, आर्सेनिक वेज. लेकिन इतना सिंप्लीफाई प्लीज मत कीजिए. अभी इस केस में भी आप देखिए नॉन वेजिटेरियन आया था, लेकिन उसके साथ वेजिटेबल भी थी. वेजिटेबल डिजायर में आर्सेनिक है. सिंपल, समर का सीजन है, आपने शुगर केन जूस पी लिया और आपको डायरिया हुआ. ओके, ये रडार में भी, फाटक में भी रुब्रिक है. तो आर्सेनिक इज द ओनली रेमेडी गिवन इन फाटक. सो डायरिया, स्ट्रॉन्ग डायरिया, उसमें भी आर्सेनिक है. आर्सेनिक अभी मैं खुद फोरेंसिक मेडिसिन पढ़ाता हूं, तो ये लिटरेचर में ऐसे देख कई सालों तक, कई जनरेशन तक आर्सेनिक एक स्ट्रॉन्ग किलिंग पॉइजन की तरह यूज होता था. यू नो, टू किल द to murder other without knowing them. So ये death poison उसको बोलते थे. और ये इतना स्ट्रेंजली अपने खाने में मिक्स हो जाता है कि उसका कोई ट्रेसेस भी नहीं मिलते, एकदम पाउडर जैसा होता है. सो कई जनरेशन तक ये किलिंग के लिए यूज होते रहे, जब तक एक टेस्ट डिजाइन हुई और उसके बाद उसका यूज प्रॉपरली बंद हो गया इस ऐसे गलत काम के लिए. सो दिस इज आर्सेनिक, दिस इज अ केस ऑफ undifferentiated connective tissue disorder. We are here to conclude. Thank you so much for your patient hearing, and thank you so much Radar team for once again giving this wonderful platform. I hope everybody has got good. Yes, Socrates was killed. Ankit, you're right. You can also help such a kids with the classical homeopathy, such an adult autoimmune patient with classical homeopathy, because autoimmunity is now literally on the rise. You know, you'll see so many patients, respected rheumatologists, they spend so many their precious years in studying MBBS and rheumatologists, but they are left with very few weapons in their hand. HCQ, anti-inflammatory, immune suppressant, this 𝐒𝐸𝐞 these are not going to solve the problem. Okay.
Hello, Dr. Rahul. Am I audible to you? So thank you, Dr. Rahul. It was a wonderful session. You have enlightened our knowledge with the session, and the
Hello, we
case
can't hear you, Dr.
beautiful.
Bharti.
And thank you all the attendees for listening us. As you now you
Dr.
can see that
Jaspal is also there.
the difference is very clear regarding the remedies. Like if the close coming remedies are here, so you can see there was a clear differentiation Dr. Rahul have presented with
Hello,
us.
Dr. Bharti.
So it was a very nice session.
I think there is some issue.
Thank you, Dr.
Okay,
Rahul.
so it is
You all ending the session.
So let's conclude from our side. Thank you, everyone. The thank yous already came from the organizer. You can just log off now. Thank you for your precious time. The important is your questions in